Hello, this is Vijaya Anish, NCLEX RN trainers at Athena Coaching Center. In this video, I am going to discuss how does insulin work in our body. So what is insulin? Insulin, it is a hormone which is produced by pancreas. As we all know, pancreas, it is a gland which has endocrinal function, additionally exocrinal function. So insulin, it is a hormone, so definitely insulin production is a function by pancreas or its pancreas endocrinal function. Okay, so in pancreas there are two kinds of cells which is present in islets of Langerhans. Those are alpha cells and beta cells. Whereas beta cells produces insulin, and these insulin usually work very hard to balance glucose level within our body. So I just wanted to explain you how does insulin work within our body. Fine. So how does insulin act in our body? How the blood sugar is balanced with the help of insulin. So for all of your nursing exam, you will get many questions from insulin and its insulin management, diabetes care, how do we give insulin, how do we teach a patient to take insulin, okay. So this is like diabetes is like a general common condition, so definitely since it is a normal general condition, so you will get many questions related with that. So this is my request. You should understand the basic physiology of each and every condition. Okay. So why insulin is given? How does it work? How does insulin work within our body? So that is I am going to discuss in this class. Fine. So we'll see what is insulin and how does this insulin act in our body. Yeah. So now look at this. Yes. As I said, insulin, it is a hormone produced by the pancreas. Right? Insulin is working to balance blood sugar level. Fine. So this is a cell. This is the structure of the cell. Each of our cell has an insulin receptor and glucose channel. And remember, this glucose channel always remain closed. There is an insulin receptor and glucose channel. Glucose channel remain closed and insulin receptors are really active. Okay? And these insulin receptors attract insulin. Insulin receptors will attract insulin. Fine? So, when the insulin get attracted by the insulin receptors, now look at this. Look at here, the insulin which is attached with the insulin receptors. As soon as it get attached with this, the glucose channel which opens and it allows the glucose molecule to enter into the cell. Clear? As soon as the insulin receptors attaches with the, as soon as the insulin attaches with the insulin receptors, what happens here? The glucose channel opens. Fine. And through the opened glucose channel, the entire glucose molecule will enter into the cell. In a very simple manner, look at this. Insulin action or the mechanism of insulin, usually we can correlate with a lock and key method. Okay. Now look at here. This is a cell. This is the structure of a cell. It's like imaginary structure. Yeah. So this cell, it is like a lock. Fine. So cell is acting as a lock here, and there is a hole of lock, and insulin is acting as a key. Fine. So insulin is connected with the insulin cell lock. Insulin as a key, cell as a lock. So insulin gets connected with the cell, and as soon as the key enter to the lock and just twist it and open it, what happens? The door opens. Okay, so this is the door. It's a glucose channel. So the door opens. When the door is opened, the entire glucose will enter into the cell. This is how glucose is balanced. The amount of glucose in the blood is balanced in this particular manner. Clear? So this is very simple mechanism. Insulin mechanism, or the importance of insulin, it is like a action, like a lock and key method, whereas cell is like a lock, insulin is like a key. So insulin enter to the lock and just open it, so the door opens. Door is like a glucose channel. As soon as the glucose channel opens, the entire glucose molecule will enter into the cell. Okay, so the amount of glucose can be managed with the help of insulin. Is that clear?